All sorts of different things that we can do for degenerative spinal diseases, ranging from removing discs in somebody's neck or in their lower back, if they've worn out that disc and it's pushing on the spinal cord or on the nerves. That would involve us removing the disc and performing a spinal fusion. We can come in from the front, we can come in from the back. Commonly, if we're doing that in the cervical spine, we would make an incision on the front of the neck, remove the disc and fuse those two bones together. That's called an anterior cervical discectomy and fusion. That's perhaps one of the most successful operations in all of spine medicine as far as I'm concerned. We can also do that from the back with a different technique. In the lumbar spine, we can go in and we can remove the discs in different ways. We can come through the abdomen with what's called an anterior lumbar fusion. Usually we would do that with a general surgeon. That's something that we do commonly here for people with disc problems. More often in somebody who's older, we would come in from behind. Again, getting back to the issue of spinal stenosis, a very common entity these days is somebody with spinal stenosis from instability in their spine. Just again, as they have aged, there's a certain subset of people will develop something called a spondylolisthesis, where the bones literally shift apart. And when they shift apart, the canal for the nerves deep inside becomes malaligned. Rather than the bones all lining up, they become malaligned and the nerves get pinched. We can go in from behind, free everything up, and then realign those bones and fuse them together. Those are operations that involve spinal fusions. Often, if somebody just has a very small focal area of stenosis, whether it's up in their cervical spine or down their lumbar spine, we can do a much smaller surgery with a much smaller incision, perhaps even minimally invasive, where we're using a small retractor, an incision the size of a postage stamp, go in and just remove some of that tissue, remove bone spurs. We can go in and do something very simple like that takes an hour or two, minimal blood loss, free up the nerves, and the person's pain is gone.